the basic anatomy and function of the foot and ankle is more complicated than you might think. There are 28 different bones in there, and as well as helping you stand up, they have to propel you forwards. That means acting as both a shock absorber as the foot comes down with each step, and also becoming a rigid lever to push off as you make your way forward along the pavement or down the ski slope. There are different sorts of injuries that occur with winter sports. Commonly, the tendons around the ankle are subject to wear and tear, or even dislocation from behind the ankle bone, and that's an injury that's commonly missed. Ankle fractures are much less common than they used to be, but you can still break the shin bone just above the ankle, obviously with catastrophic consequences and a need for immediate treatment, usually in the resort. And then there are chronic conditions. A lot of skiers will be familiar with a pain in the ball of the foot from where the ski boot's tight, and we see quite a few patients coming through with questions and problems there. Only about 6% of all skiing injuries actually affect the foot or the ankle. So compared to the shoulder or the knee, it's a much lower proportion, but obviously your foot and your ankle are important to you in everything you do, so they assume a greater significance. They say you have 2.5 injuries per 1,000 days of skiing. So for the average person who maybe skis once a year, you're going to have to go for 60 years before statistically you'll pick up any injury, and only a small percentage of those are the foot and the ankle. And we've seen a lot of improvements in ski equipment over recent years. The shorter carving skis, I think, make you less vulnerable, and certainly the modern hard ski boots equally take a lot of the strain off the foot and the ankle. So skiing and snowboarding offer different opportunities to injure yourself. Firstly, perhaps due to the risk-taking profile of the different sportsmen and women. Snowboarding, obviously an all-terrain sport, a lot of skiers stick to the piste, so that's one factor. Secondly, the equipment's obviously very different, one leg being free from the other with skiing, the two moving together with snowboarding, and the boots are an important factor in this. The soft snow boots that most boarders use now do leave you vulnerable to different injuries to skiers. A strain and a sprain are pretty much the same thing. A strain is really a mechanical term to do with how much something is stretched when force is applied to it, whereas a sprain is a more medical word which implies that a ligament binding two bones together has been slightly or completely, depending upon the severity, disrupted or stretched. But the words are used interchangeably. People who are going to go on a winter sports holiday are often worried about injuring themselves, but they're also worried about whether a recent injury will be safe to take on a skiing holiday with them. Taking the second group first, it's fair to say that anyone who's recovering from a sprained ankle, perhaps out running or walking the dog, is almost at an advantage in their ski boot because the limb is held so securely that they're not going to cause themselves any further damage. With new injuries, of course, it's important to be careful on the slippery surfaces around skiing, and a lot of injuries happen either during après-ski or just getting to the slopes when walking without the boots done up, where the ankle is more vulnerable. Some injuries are more serious than they first appear and aren't easy to pick up. In particular, tendon injuries, because the x-rays look reassuringly normal. Skiers who come back with a painful swollen ankle should be particularly aware that if they feel a clicking and flicking around usually the outer side of their ankle bone, then they may have disrupted the tendons or the seat belts that hold the tendons in place, and that injury is best treated quickly, because if it's left to become a chronic situation, it can be more difficult to rectify. So if someone comes back from a skiing trip with an injury, I think they need to get it properly assessed. Often in the resort, where they're expert at first aid, they'll have had really good initial treatment, but the question then is, how serious is it? What's the ideal rehabilitation? And just occasionally, does it need to be fixed? So a proper assessment with someone who's familiar with these injuries and some appropriate x-rays or occasionally a scan is an important thing to do if the symptoms don't settle down quickly.